Hello guys, I'm Marjorie Kanaga and welcome back to my YouTube channel. I'm here with a visitor who is going to talk about assessment, and kindly introduce yourself.
Thank you very much, Marjorie. My name is Cosmas Onywera. I am in Kisumu County. I work as the coordinator of special needs education in the county of Kisumu. And this is a Kisumu County Educational Assessment and Resource Center. In short, it's called IAC. This is a center which performs functional assessment for learners with various disabilities for the purpose of appropriate placement to school and other related services. Thank you.
So, what are some of the activities you perform?
Yeah. First of all, I want to say that we perform several activities. And we perform these activities here every Wednesdays and in the field. One, we assess children with disability from mainly age 0, because we are interested in the prenatal stage of the child, as related to the disability that we are seeing. So we go up to around age 7 or sometimes 12, sometimes even up to 14, the school going children. So they are brought here and we assess them. We do diagnostic assessment through a multidisciplinary approach. We have various people who are trained in various fields of disability. So we screen these children here, and then we advise the parents appropriately for the appropriate services.
Okay.
We talk to the parents to try and demystify disability. We do parental collaboration and engagement. We have some parents that we have put in groups. We also visit schools to monitor the progress of the children that we have placed in schools. We advise teachers and other stakeholders within the school on the appropriate methods of differentiated education for these learners.
Okay, that's nice. Okay, in a case whereby a parent has brought their learner for assessment, and then you place the learner, or maybe refer him or her to a medical center, but later on you find out that the parent has not taken the learner to school, what do you do?
Marjorie, most of the time it is a challenge, and the example you have given is very typical. A parent will have brought the child here. We will have done our bit. The medical practitioners will have done their bit. Then the parents sometimes are not able to take the child to school for various reasons. Number one, probably there are costs attached to the education of the child. Probably the parent is still stuck in the mystery of disability. Yes, the myths. So what we do, we follow up these parents. We still follow them up and try to talk to them. Sometimes we try to link these parents with the other partners. We have a bit of partners around who work with these children, who want to support these children. Lena Cheshire, Heart to Heart, VSO, there are many. Yes, Cheshire Disability, there are many. We work with them. So sometimes we can connect these children to them, and then they see how they can support them. But the government of Kenya also supports the education of learners with disability through capitations and through funding them, ensuring that at least they can get appropriate assistive devices and learning materials. So once we identify them and we take them to school, we are able to go around it.
Okay. Now this is your assessment center, right?
Yes, yes.
What happens? What is the process? Okay, I mean the process when a parent comes in with their learner.
When a parent comes in,
yes.
Number one, we have a holding room there. Yes. We register them. We register them on first come, first serve. Then we are about seven here. So when they come, we start from background information. We pick the background information of the child. What is happening with the child, the names, the parents, contacts. We ask the parent a very simple question, very simple questions. But one of them is, what is the problem with your child? Why have you brought the child? My child is not able to talk. My child is hyperactive, not able to concentrate in school. My child has a physical disability. You see this foot. My child has a problem with this foot. So they'll tell, we are able to pick it from a professional angle.
Okay.
So from the background information, then we can go to particular tools. We have particular tools to screen different kinds of disabilities, ranging from physical to even behavior disorders and etc. So we pull out a tool specific for this child, and we will screen. Now, you remember I have told you that we are a multidisciplinary team. Sometimes we feel that this child needs further medical diagnosis. So we refer. We have medical practitioners that are within our group. So we refer the child. The medical practitioner will refer back to us, and then we are able to now place the child.
Okay, and what are some of the tools you use to assess the children, the learners?
We have both paper tools, designed tools, and we also have machines. And for example, we have a machine like nerve stimulator. We have an audiometer. We have an audiometric room down. No, it is not here, but it is down there. Any learner with hearing impairment, we take there, and they can be screened using an audiometer to get their decibels. So we use some simple machines, but we also have screening two papers that we use.
Okay, that's nice. You said you're working with that team.
Yes.
Do you also work with teachers?
Yes, we work with the teachers because teachers, many times they are the ones who, apart from parents, teachers are the big group also that refer the children to us, because they will have screened them from the school. They will have seen there is a problem, so they refer them to us. Then you realize I said that our main function is to refer these learners to school. So when we refer them to school, we have to communicate with the teachers, and we have to visit these learners in school. So any prescriptions that we have as mitigations for these learners, they are done by the teachers.
Okay.
Yeah, so we talk with the teachers, we engage with them many times.
Do you also refer the learners with disabilities, the ones whom you've assessed? Do you
Yes.
also refer them to regular schools?
Yes, we do, because not all learners, that's a nice question. I like that.
Okay.
Not all learners with disability are meant for special school. In fact, we don't refer learners to special schools as much as we do to regular schools. Only those with disabilities that cannot make them cope in the regular schools are the ones we refer to the special school. But majority of the learners that can cope in the regular school, we refer them to the regular schools within their neighborhoods.
Okay, and do you do maybe a follow-up on those cases?
Yes, we do.
Okay, for a case where I think the other year, when was it? The other year, was it 2021? I'm not sure of the year.
2022 last year.
No, the other year.
The other year.
After the other
Yes.
2022, 2021, I mean,
Yes.
there was a case, I saw it on the internet, there was a case whereby a learner, I can't really identify the school, but a class 8 learner who had a disability reported to a school, a regular school, a normal school, and then the principal to that school chased the learner back
from getting,
because the child had a disability. How do you handle such cases, or maybe your view about that?
Those could be isolated cases, but they are there. The issue of disability still not being fully demystified is still there. One big impediment to the education of learners with disability is the attitude.
Okay.
Many players still have negative attitude towards learners with disability. And so what we do is to still do a lot of advocacy. Uh, if there are cases where learners with disability are denied access to education to any institution, I can say that anytime that is brought to our attention, then this is one place that we rush to and ensure that the rights of this child is not infringed. Today alone, as I sit here, I have been to 7 schools to monitor admission of learners with disability to junior secondary school. Okay. It was brought to my attention that some schools have actually enrolled these learners in their junior secondary school, and to us that is a big plus. So we went around with my 2 colleagues to specifically visit those schools to see if those learners are there and what are the coping strategies that have been put in place by the school to ensure that these learners benefit.
Okay. Yes. How many years have you been in this field?
Hey, for about I think 21 years.
21?
Yes.
That's a long time.
Yes.
Okay.
I was a teacher in an integrated school that had learners with physical disability called Nyabondo Day. That was a school that I was posted as a young teacher in 1992. Yes. So then I started developing interest. So I decided to further my education in the area of supporting the education for children with disability.
Oh.
So I have been in this field
for the longest
time of my profession.
Before I was born. So yes. do you work like as a just like as an assessment or whatever, or you have other organizations that you do work with?
First of all, I am employed by the government of Kenya as an assessment disability assessor in functional assessment. We work with the government supports us, but we are also supported by other partners who are working in the field of supporting the education for children with disability. Okay. We work with them. Oh. Wherever they come, we are always very ready to work with them.
Okay. Yeah. So what is your inspiration? What inspired you to be who you are today?
What inspired me to work with these children?
Yes.
First of all, when I came from college as a young person, I was posted to a school that was integrating learners with disability. And somehow through the grace of God, through God's making, I got interested in supporting them. Probably God wanted to use me to support them. Oh. So what inspires me is that I draw a lot of happiness in seeing them happy when I work with them. So I think my inspiration is probably is from God.
Oh, it's a
because
calling.
It's a calling. The work that I do, I think, is not commensurate to what I would say that the government pays. It's a calling.
Yes. Do you have an other outside job, or you are just focusing on?
No, I don't have any other outside job.
Oh.
This is my job, supporting the education of learners with disability.
Okay, that is nice.
Yes.
So what do you have to tell people outside there who are like acting negatively towards the people with disability?
I want to tell them that disability is not inability. I also want to tell everyone that the onset of disability can come anytime. So those who think that they have no disability should think twice, because disability is just the inability to perform a function due to a reason. And one of the reasons can be an impairment. So I want to encourage people and say that children and persons with disability, first, they are just persons like us. They need our support. They may not need our sympathy. They just need opportunities. Give them opportunities, give them support, understand them, give them appropriate services, and they are good to go. So I want to ask everyone to just stand out and be counted as supporters of children and persons with disability, especially by giving them education that will empower them and that will make them self-reliant.
Okay, that's nice. Thank you so much, guys. That has been it with our video, and thank you so much.
Thank you very much, Marjorie.
Okay,
You are welcome. Another
I,
time.
I appreciate.
Yes.
Okay, that has been it, and bye, guys.
Thank you. Thank you very much. Yeah, so welcome to Kisumu County Education Assessment and Resource Center office. On the other side, we have administrative rooms. But this is our assessment room. Welcome. These are the stations where we perform our assessments. So when our clients come on first come, first served basis, we take them to the different tables. So you can see this is our client. I think he could be joining from one. So a child with disability joining a school, there is a requirement that they should be assessed and an assessment referral form filled. So this is a client who is joining Form 1, I think, at Joyland Special Secondary School. Yes. So this client, I think he has come from one of the primary schools. I think the one of the regular primary schools. So this is the parent, and this is Mr. Gundo. He's one of the professional assessors here. So he will assess the child using that background information tool, and then he will do the rest. The school, secondary school, cannot admit him without assessment recommendations and assessment letter. So from here, this is another table. So various clients will sit on different tables. Where these are just assessment material, some of the few assessment materials that we use. Let's say sometimes we want to assess a client on with the LD. We want to even look at perception, color, contrast. Are they able to even grip? We will have learners, children. We want to assess their dexterity. We want to assess their grip and etc. So we give them these playing materials so that we are able to assess the level of concentration and the level of grip, the fine motor ability, grip and hold and release. We have these books. These are just our record books. You can see the name of the client, when the client came here, what is the guardian's name and contact, what diagnosis, what did we find the client with? We found this client with speech difficulty. Yes. What is the recommendation? The recommendation is that there is need for speech therapy where at such a place. This one has been placed, another one has been placed to a special school. Which one? This. So with this register, we are able to track our clients. Now, this lady you see here is one of the, you asked me about the partners we work with. This lady is called Lavina. She's one of our great supporters. She works with an organization called Heart to Heart. It's an organization that supports the education of children with disability and persons with disability in terms of empowerment. So she came to visit us today. So she's one of the partners that we work with. Wherever there is we have a partner, we have a client, and we think the client needs something that we cannot get through the education system or the ministry, then we can talk to Lavin, and then she can be able to give us a wheelchair, a crutch, or a hearing aid, or probably sometimes even supporting surgery or medication for some of our clients. And it is good she's here. So then this is another station. This is one of us, Charlene. Charlene is here. She's trained in special needs education. She works here. Actually, Charlene works here as a volunteer, and we don't pay her. If you are talking about people with passion, then she has a passion. working with the children who have disability. Yeah, so we have a myriad. If you look at this is a placement form. We will have assessed the learner, then we want to place. I told you that our main focus is appropriate placement. So for us to appropriately place, we use this tool, this form. We will write it like this is to Lutheran Special School from us, and we shall say we have referred this learner for this. We also have other referral forms that we use to refer the learner probably to a medical practitioner or to any other service delivery agent. Yes. The hearing aid, the hearing ability room, which is closed now, there, and it is one of its kind in this region. That is the place where the hearing levels are measured, the decibels, and then we are able to know this one needs a hearing aid of this nature, or this learner has the hearing ability is this. So we advise the teachers and tell them this learner has this hearing ability, loss of hearing, and so the strategies should be this, which may include preferred sitting position and etc. Yes.
So guys, that has been it with our assessment center, right?
Yes, in Kisumu.
Okay, in Kisumu. So
for children with disability.
For children with disability. So guys, if you have a special need learner back there and he or she has not come for assessment, kindly refer him or her to this place.
You want us to give the phone numbers?
Yes, you can as well give it.
This is Kisumu County Education Assessment and Resource Center. We are open on Wednesdays, every Wednesdays. We are open from 8 to this time. Yes, so we have several people working here. Any of them, their numbers can be used. But my number is 0724 145 250. Yes, if you call me, I'll be able to refer you to the others who will be. But it doesn't have to be Wednesday alone. If there is need, then we have Charlene. She stays around. Gundo and Wilson, they stay around. We can always mobilize them.
Okay, okay, guys. I hope you have heard that. Thank you so much, and kindly subscribe to my channel. Bye.